Welcome to Field Notes, Insights from N2PH Health Alumni. N2PH Health is a year-long workforce training program for those who are new into the field of public health. I'm Juliana Mansky.
And I'm Mackenzie Legal. We are program facilitators and hosts of this podcast. With a vibrant community of over 400 current and past residents, N2PH Health is a wealth of knowledge and experience in the public health field.
In each episode, we'll share inspiring stories and valuable insights from those who've journeyed into public health, highlighting their unique path and the impact they're making. Joining us today is Alisa Gefter, a public health worker from Michigan, as well as being a volunteer organizer for the American Cancer Society's Cancer Action Network. Alisa graduated from the N2PH Health Residency Program in January 2024. Alisa, thank you so much for joining us today. Would you start by telling us a little bit more about your background and a little bit about yourself?
Yeah, of course. Thank you so much for having me today. It's a pleasure to be back talking about the program. I had a really good time when I was in the program, and I definitely learned a lot. So a little bit about me. I have a master's in public health from Wayne State University. I have a huge passion for cancer prevention, cancer research. That's like my main thing that would be like my goal. I have worked for the CDC as a contact tracer during COVID times. I also was an intern for Gilda's Club, which is a cancer support community, helping both the patients and the caregivers over there. Did a lot of like community outreach work over there. And then I also worked as a research assistant at Wayne State University doing type 1 diabetes maintenance program recruiting and tracking of those clients there as well. And additionally, I was a health educator for a health department doing emergency preparedness work.
You have a wide variety of experiences that really must help influence the work that you're doing with the American Cancer Society now. And if you would be willing to share, I'd love to hear more about your policy advocacy work with the American Cancer Society. As you may recall, my background is in oncology nursing, so this work is especially meaningful to me too. And I always strive to find ways to more explicitly kind of marry that connection with cancer prevention and public health.
Yes, of course. So while I was working in health education, I knew I wanted to do something more outside of work. So this is a completely volunteer role for the American Cancer Society. The specific Action Network is the advocacy part of it. So I started off as just a advocate, sending out emails to representatives. We would get not weekly, monthly updates about what's going on politically, what's going on with cancer research, different things like that, different asks that we had. And I was quickly brought up to the role of being a lead from that district. So I currently have 50 volunteers in my congressional district that are all advocates doing the same thing I was doing when I first started. As a lead, I have been able to travel to both Lansing, which is in my state of Michigan, so that's for the state representatives. And I also have traveled to Washington, D.C., to talk to the federal representatives over there about our cancer policy asks. And I've done that for 2 years in a row already. So it's been a really amazing opportunity to go do that in the first place and have the one-on-one times with the representatives.
That is so interesting. Is there any more that you would want to share about that time, especially at that time in your state, and maybe some of the differences between how you talk with your state legislatures versus when you travel to Washington, D.C.?
Yeah, so both times we go over like how we want to present ourselves and how we want to specifically ask when we talk to the representatives. Um just to start, yeah, being a part of the American Cancer Society, specifically this advocating side, has really made a big difference in my life, and I was able to make instant connections with everybody there, no matter the age, no matter like the experience anyone had with cancer. Everybody just immediately was like super passionate. Everyone had very similar stories and just goals in terms of cancer and making sure that the representatives are actually listening. So we always like to share a personal story when we go talk to the representatives in person, both on a state and on a federal level. It's pretty much the same. The only thing that changes is the asks, because we have different asks depending on the state and then what the federal asks are. And actually, currently, we don't have an updated ask list for the federal side because we actually just recently got an approval on one of our asks that we were fighting for several years now. It's called the Multi-Cancer Early Detection Screening. So this is something that it's a blood test that can detect for over 30 different cancers as an early detection screening phase. So like it wouldn't necessarily replace mammograms or colonoscopies, but it would be able to detect all these different cancers just through one blood test. It will go through the FDA, get the approval, and will be more affordable for people who need it. It's going to be more affordable and more accessible to people in order to get that blood work done.
Congratulations. That
Yeah,
is
so
a
we're really excited about that.
yes, that is a huge win for the cancer world, but also the public health world and
Yes.
prevention and those various levels of intervention.
Yeah.
That
And
must feel
then
so good to be part of.
yes, it was really exciting to see that because it was something that we were literally in DC for this past September, like asking about. Everybody seemed on board, but it was just in terms of priorities and different things like that. So we were really happy to see that through each stage, like, oh, it passed through the reps. Okay, now like through the House of Representatives. Okay, now it passed through Congress. Oh my gosh, now it actually passed through like all the steps. So it was really cool to see that happen. So don't know how soon that's gonna be like being implemented, but it's just very exciting that that happened.
Yes.
And then our current asks on the state level, so for Michigan specifically, I can list those off and kind of expand on those if you would like to hear.
Yeah, that sounds great.
So we have a few asks. We have three this year, and it is on tobacco prevention and cessation. So making tobacco product less accessible because we know that it is causing cancer. It's pretty evident through research that smoking and tobacco products can lead to lung cancer. Lung cancer is, I believe, one of the top three most common cancers. And so if we can reduce that risk, of the preventable disease, that would be great. So just getting more money for programs to do the tobacco cessations programs. That's one of our asks. The next one is called the copay accumulator, and that one's a little bit harder to explain. So for the copay accumulator, it's pretty much getting representatives to support legislation that will restrict the use of the copay accumulator adjustments in health insurance plans. So what this means is when you pay for expensive treatments or for the prescription drugs you need for just cancer in general, there's a lot of out-of-pocket costs for the patients. And what certain insurance companies are doing is not counting it towards your deductible or your maximum out of pocket, like for out of network. What we're trying to do is to get Michigan cancer patients and others to rely on the prescription drug copay assistance to help pay for the high costs of drugs and help them meet their maximum out-of-pocket limit instead of just paying out of pocket and it not counting towards anything because it's already so expensive to do all these treatments. So that's one of our other asks, pretty much so that we can get the insurance companies to actually follow that.
Mhm.
The other ask that we have is specifically about the Detroit Metropolitan Airport. They have been trying to kind of behind the scenes make a cigar lounge in the airport inside of it. So we have a petition going around to try to make it not happen because we want it to be smoke free. Because as we mentioned in the last example, with the tobacco prevention and cessation programs, lung cancer is not a joke. It's very serious. It's very common. And we know that tobacco products, smoking, cigars, cigarette, like any of those can cause cancer. And it kind of feels like a step backwards by putting a cigar lounge in. So that's another one of the things we've been working on is getting people to sign this petition. Yeah, so those are our three
Great.
asks that we're working on right now in the state of Michigan. And as I mentioned before, we talked to both the state and federal representatives, and it works. Going out to talking to the representatives, sharing your story, sharing what you're passionate about, and then also giving the asks face to face, not just over email or calling, makes such a big difference. And it like you truly see a difference there.
That is really insightful and a lot of work that there is. So, if someone is beginning to explore policy advocacy, um, what advice would you share with them to get started?
So yeah, it's actually very easy to get started. When I was looking for this role in the first place, just as an advocate, just looked up American Cancer Society, saw that there was an advocacy section, thought that was really cool. And then you go from there. It asks you just some basic information, like for contact information, and they'll reach out to you. So if you want to help to advocate for cancer research and cancer advocacy, you can go to fightcancer.org and that'll take you directly to that link or to that page rather. And you can sign up there and depending on where you live, you'll be with that group of people and you'll probably get started as just an advocate, but there's so much room to like move up with that. You can participate as much as you want. If you don't have a lot of time, you don't have to commit that much time. You can just be the one who sends out emails to try to get in touch with your representatives. There are still things you can do if you don't have a lot of time to invest into it. Another benefit of joining the organization is it really helps you get out of your comfort zone and to share your story, as I mentioned. Even if you don't get a chance to go to Lansing or to DC to share your story, we've had people, myself included, go to meetings where they come talk to the like coffee hours and you just stand up at the mic if you're comfortable and do that same thing. You just bring up the topic that we're trying to fight for to advocate about and it makes a difference. Like I did it one time and I was talking to Debbie Dingle, which is my rep, and I was sharing about that early detection screening, that blood test, and she was well aware of it because we've been talking over email. But there were people in the crowd that had no idea what it was, so I was able to explain specifically what it did and what the benefit of it was. And people had questions about it, and just even spreading that and letting the public know more about it can make a difference as well.
That is so true. Alisa, thank you so much for sharing your insights and experiences with us today. Your story reinforces that meaningful change happens when we use our voices beyond our day to day job. And so I hope that this conversation will help intrigue others to explore policy advocacy. Thank you so much for inspiring us to think bigger about the impact that we can make and for offering all those tangible ways that we can get involved in this policy space.
Thank you for listening to Field Notes, Insights from New to Public Health Alumni. For more information, visit new2publichealth.wisc.edu.